Hi, good afternoon, everyone. I'm Zohal. I'm a staff attorney here at the Public Health Law Center. And I will just go ahead and share my screen with you all. So thank you all for coming today. We have an excellent panel for you all. We're going to be discussing the current state of New York's commercial tobacco control landscape. And without further ado, let's get started. So before we begin, we'd like to take a moment to acknowledge the history of the land that the Public Health Law Center sits on in St. Paul, Minnesota. These are the tribal and treaty homelands of the Dakota Oyate people, who are part of the larger Sioux Nation. We also acknowledge the regional territory of the Ojibwe, also known as the Chippewa and Anishinaabe people. We also acknowledge the ancestral connection of the Ho-Chunk Nation to this region. I'm physically located in DC today, and so I'd also like to acknowledge that these are the traditional homelands of the Nacotchtank and Piscataway people. And finally, since we are going to be discussing the great state of New York, we'd also like to acknowledge the ancestral homelands of the Lenni Lenape, Mohican, Shinnecock, Unkachog, and Haudenosaunee peoples, which includes the Seneca, Oneida, Cayuga, Tuscarora, and Mohawk nations. So if you're not familiar with us and our work, I just like to take a moment to introduce the Public Health Law Center. We're a national nonprofit that collaborates with others to reduce and eliminate the use of commercial tobacco, promote healthy food, support physical activity, tackle climate change, and address other causes of chronic disease. We are also the Center of Excellence in Tobacco Policy. We have partnered with the state of New York to provide legal technical assistance to the New York State Department of Health and commercial tobacco control professionals, partners, and advocates in their work to end the commercial tobacco epidemic in New York State. And I'd also like to take a quick moment to define what we mean by commercial tobacco. So we are not referring to the traditional use of tobacco by indigenous communities. Tobacco has been used by many American Indian communities for spiritual and healing purposes for thousands of years. What we are tackling specifically is commercialized tobacco products, which excludes traditional use. And for more information, we recommend visiting the website of the Cupid Sacred Campaign, part of the National Native Network. Another important piece of information is that we provide legal technical assistance, including help with legal research and assistance with policy development, implementation, and we may also provide litigation support, such as by filing amicus friend of the court briefs in high impact cases. We develop publications that explain complex public health and policy issues and run trainings on commercial tobacco control topics. It is important to note that we do not provide direct representation and we do not lobby. And all of our work at the center is grounded in health equity. We're committed to removing all institutional barriers and applying an equity lens to our work to produce the best results for the communities that we serve, which may have differing needs. It's important to remember that people are differently situationally, so the same policy approach will impact groups in different ways. And here is a lovely chart that explains the differing social determinants of health. There are many factors that can affect people's health, and it's important to keep that in mind when considering policy proposals. For instance, imposing monetary penalties for tobacco regulation on an individual struggling economically will contribute negatively to the social determinants that can lead to adverse health outcomes. So it's important to be mindful of the different way that an individual's health can be impacted when implementing tobacco control policies, commercial tobacco control policies. And without further ado, I'll go ahead and introduce our speakers for today. So first up, we have Kevin Schroth, who's an associate professor with Rutgers Center for Tobacco Studies and School of Public Health. He teaches public health law, and his research focuses on how tobacco regulatory science can improve tobacco control policy. Kevin previously served as an attorney with the New York City Health Department, directing tobacco control policy for the city. During his tenure, Kevin played a principal role in drafting and passing more than a dozen tobacco control laws. And before joining the New York City Health Department, he worked in commercial litigation and served as a law clerk for judges in federal and state courts. Kevin earned his JD from Rutgers Law School and his Bachelor's of Arts from Bucknell University. After Kevin will be Mark Meaney, who's the Director of Commercial Tobacco Control Programs at the Public Health Law Center. Mark leads a team of attorneys and policy analysts working to support equity-focused tobacco control policy change throughout the United States. Third up, we have Mike Freiberg. He's a co-lead senior staff attorney for the New York Technical Assistance Commercial Tobacco Control Program. He provides legal technical assistance to jurisdictions around the country working on various commercial tobacco control policies. Mike has taught classes in legislation and public health law as an adjunct law professor at the Mitchell-Hamlin School of Law. And he's also currently doing excellent work serving as a Minnesota State Representative. And last but certainly not least, we have Kelly McAnnany, who is a co-lead senior staff attorney for the New York Center of Excellence in Tobacco Policy, where she provides legal technical assistance on commercial tobacco control issues in the state of New York. Prior to joining the Public Health Law Center, Kelly practiced civil and human rights law in New York City, where she focused on corporate accountability, disability rights, and racial justice. She also served for several years as executive director of a health advocacy organization dedicated to expanding access to care and reducing health disparities in the state of Minnesota. So without further ado, I will stop sharing here and pass it on to Kevin.
All right. This is my first of 50 slides about New York State tax law. Just joking. I don't even have 50 slides. All right. Here's a slide that shows New York State taxes for cigarettes and how they've increased over the years. Going back principally to 2000, the tax rate was pretty low at that point. It increased 55 cents to get to $1.11. In 2002, it went up a little bit more. 2008, it went up substantially to $2.75 per pack. And only 2 years later, it went up to $4.35 per pack, which is where it is today. New York City, since 2002, has had an extra $1.50 tax per pack. As a result, New York State, and in particular New York City, have among the highest cigarette taxes in the country. And Governor Hochul recently announced a plan that would, if implemented, increase the cigarette tax by another $1 per pack. So it would go from $4.35 to $5.35. And I'm not going to share the draft legislation because it's about as simple as that. Shortly after she made her announcement, some opponents of tax increases started writing about it. And the opposition arguments that they highlighted are the same opposition arguments that tobacco industry and anti-tax advocacy groups or commercial interests have advocated for many years. They argue that tax increases fuel illicit markets. They actually decrease tax revenues. They hurt consumers, and they hurt small businesses. I'm going to walk through a number of those, or all of those opposition arguments. So first, one of the opposition lines that I mentioned is that taxes fuel illicit markets. Illicit markets do exist, and it would be wrong to ignore them or to minimize, the significance of the issue. But to suggest that they are counterproductive and that they do not serve as a benefit towards public health is really misleading. If taxes were counterproductive, we'd expect to see some type of evidence of that. This chart shows youth smoking rates in New York State, and I'm focusing particularly on the red line, and it shows how much youth smoking rates have decreased from 2000 to 2020. Not only do you see a pretty steady, stable trend line of a decreased youth tobacco use, but the circled red triangles highlight the years where there were increases in tobacco taxes. And those tax increases clearly do not reflect any increases in youth use, and it's far more likely that they contributed to the continuing decrease in youth use. I don't have a slide that shows the decline of adult smoking over this period of time, but it follows the same trend. And I'm going to move on here. Here's a slide that shows tax revenue and how that has changed over the years in New York State. And again, one of the misleading arguments that opponents of tax increases often make is that tax increases lead to declines in revenue. Now, you can see here that from 2010 to the present, there has been a decline in tax revenue, but that was a period of time where the cigarette tax has not changed at all. The cigarette tax here, just to be clear, is reflected by the red line that's increasing as we move from left to right, and then it flattens out for the past 10 years or so on this chart. And the blue lines represent tax revenue. So you can see that tax revenues have trended upwards up until 2010, and then they've trended down. But looking at it from a different perspective, I have arrows here highlighting when there were tax increases. And you can see that every time that there is a tax increase for cigarette taxes in New York State, there's an increase in tax revenue, followed by a fairly gradual decline in tax revenue. And then as taxes are increased again, revenue goes up again and then declines again. So I think it's likely that if there were an increase in cigarette taxes, we would see a similar pattern playing out. And I should also just point out, this is fairly obvious, but when you're seeing a decline in tax revenue since 2010, as I mentioned before, that's consistent with a decline in tobacco use, and that is an important public health impact of tobacco taxes. So let's talk about some of the benefits to the public. First, New York State has very high tobacco taxes. Only Washington, D.C. has a higher tax for a jurisdiction in the United States at $4.50 per pack. Connecticut is the same as New York at $4.35. And cigarette smoking is low in New York State. It's 12%, 4.2% for youth, lower than national averages. And if you look at tobacco taxes across the country combined with smoke-free air laws, you'd find that states that have high taxes and strong smoke-free air laws have some of the lowest smoking rates in the country. And the converse is true, where states that have low taxes and weak smoke-free air laws have among the highest smoking rates. So there's a clear correlation between those policies. Just to focus one additional thing on the benefits of tobacco taxes, tobacco tax or high smoking rates result in enormous health costs. Tobacco tax revenues, in contrast, are in comparison far lower. In 2018, Altria estimated that $63 billion were generated annually from excise taxes, MSA payments, sales taxes, and income taxes of people that work in tobacco-related businesses. So even looking at Altria's estimate, the cost, the amount of revenue generated from tobacco taxes, $63 billion, is far, far lower than the cost of tobacco-related health issues, which total $326 billion per year. That said, there are disparities. Here's some data that shows disparities that are persistent among adults. So even though tobacco taxes have been helpful in reducing smoking rates, among some portions of the population, more success is needed. And that includes people on Medicaid, unemployed people, low-income people, people with mental distress, less than a high school education, and disabilities. There has been some progress among these groups, but not enough. Similarly, there are geographic disparities around New York State. This slide shows that states that are colored in blue, or at least, I'm sorry, counties within New York State that are colored in blue have relatively high smoking rates compared to those that are green and yellow. And finally, looking at menthol smokers, which is relevant to some more information we're going to talk about today. If you're looking for disparities, you find that people that fall into certain ethnic and racial groups have higher use of menthol cigarettes. And we know from the data that menthol cigarettes are more difficult to quit. So there are another opposition argument to tax increases is that taxes are regressive and they impose an unfair burden on people who are least able to afford it. I think a good response to that is that research shows that tax increases can actually help to correct disparities, and that the health benefits of tobacco taxes far exceed the liabilities, and those benefits accrue disproportionately to low-income people. And I highlighted a study that says exactly that here. And one of the final arguments, at least that I'm going to talk about today, is that tobacco taxes have a negative impact on small businesses. Anytime that there's hearings on proposing tobacco tax increases or many other types of tobacco control interventions like bans on the sale of flavored tobacco products, small businesses and small business owners in particular come in and testify that regulations on tobacco products will drive them out of business. And they've been doing that for decades. And some of the same people that have said years ago that tobacco interventions would drive them out of business keep showing up and keep testifying that they're going to be driven out of business, but nevertheless, they still are in business. In any event, I guess one of my points is that there's very little evidence that there's any truth behind these small business arguments. And I started searching for evidence of the contrary, evidence that tobacco regulations are unlikely to have a significant effect on small businesses. And I actually found 4 really interesting studies coming from Philadelphia, New York City, New Zealand, and Australia, all based on the idea that tobacco customers usually don't buy products other than tobacco. And when they do, they're not buying an awful lot and they're not great customers. And all 4 of these studies found essentially the same thing. The New York City study, which unfortunately was published, but the published version of it is focused on food policy. I happen to know the tobacco end of it because I was working with the New York City Health Department at the time. But the way the study was conducted, there were people that interviewed customers walking out of retail stores in all 5 boroughs of New York City and asking them a series of questions. And they found that 10% of the people who were interviewed purchased tobacco, and 5% of them purchased tobacco plus other items, which means that there were a significant portion of the tobacco purchasers, about half of them, who didn't purchase anything else. And the ones that did purchase another item spent less on other items than the people that were not tobacco purchasers, but purchasers of other types of products. So one of the takeaways of this study was that non-tobacco customers spend more on items that tend to have higher profit margins than tobacco customers do. And as I mentioned before, these other similar studies have quite similar findings. Philadelphia, Australia, New Zealand found that customers who purchased tobacco was a pretty small segment of all customers surveyed, roughly around 10%. And only about 5% of people were purchasing tobacco and another item. And all of these studies had some analysis on what the non-tobacco customers were spending. In New York City, as I mentioned, the non-tobacco purchasers spent more. In Philadelphia, they found no significant difference between the tobacco versus non-tobacco purchasers on that front. In Australia, there was no evidence that tobacco purchases led to unplanned purchases of other items, which is another part of this what I call a myth, that people who are coming in to buy tobacco leave with milk and bread or other items in their bag, and there's just not evidence of that. And in New Zealand, there was also evidence that non-tobacco customers spent more. And so each of these studies comes away with similar conclusions, and I'm going to just zip through this pretty quickly. Here's the Philadelphia slide. Most people were not purchasing tobacco. New York City, I already spoke about that one. In New Zealand, tobacco products constituted a small proportion of items purchased, and tobacco is typically not purchased with other items. In Australia, they found that tobacco was rarely a reason for store visits, indicating it's unlikely a key driver of consumer food traffic. And there was no evidence of unplanned purchases. And a major takeaway was that banning tobacco sales completely was unlikely to have a pronounced negative impact on small retail stores. This is just a slide that summarizes some of the main points that I made with respect to some of these typical arguments made by opponents of tax increases and other tobacco control interventions. Thank you.
Well, thanks everybody for joining us this afternoon. I really appreciate the chance to talk to you about all these, what we think are extremely important topics. We're going to switch gears from taxes to flavored tobacco policies. And I'm going to share my screen here. Okay, hopefully you can see that okay. As Zohal mentioned, my name is Mark Meaney, and I'm the director of our commercial tobacco control program at the Public Health Law Center. And she gave us some background on the organization. So the next three, Mike, Kelly, and I are going to talk about a lot about flavor policies. And Mike's going to talk about the governor's initiative, which is a little broader than that. I'm going to give a very, 10,000, 30,000 foot level introduction to flavor policies, talking about different policies around the country and sort of the evolution of what we've been seeing, which has been really exciting. In addition to that, I'm going to talk about, of course, the industry. You can't talk about any of this without the industry's responses. And I think they have been vigorous and multifaceted. And I think it's important for us to know how the industry reacts to flavor policies, because I think it tells us how important flavored policies are to the tobacco industry. And it also it shows us ways that we can be very proactive in developing sound, legally defensible policies that are going to be effective in doing what we want, just to reduce the use of flavored tobacco products and all tobacco products, and ultimately to reduce health disparities. So I think it's always important to start with the legal framework, because there is a lot of talk about the litigation that the industry, the industry has been litigious in all areas, and this is especially true in flavored policies. But most of this falls under the Tobacco Control Act, most of the lawsuits that have been filed. And there's really three different provisions that are important to understand within the Tobacco Control Act. And those set forward the framework for state and local policies for all types of sales restrictions and regulation of tobacco products. That's the preservation, preemption, and saving clause. And I think it's just important the key takeaway is that the Tobacco Control Act very specifically grants the authority to prohibit the sale of tobacco products for state and local governments. It does have a preemption clause, and this is what the industry argues in most of their lawsuits, that doesn't allow state or local governments to establish requirements that are different from the FDA regarding tobacco product standards. And that's not a defined term necessarily, but it really means manufacturing standards. So identifying which ingredients can go into products, how they're packaged, those kinds of things. But then it has also the saving clause, which kind of reiterates what's in the preservation clause. That it doesn't apply to requirements related to the sale of products. And this is just the, kind of the overall framework that I think we work within, and which the courts have upheld. And we'll talk about that in just a minute. So flavored tobacco restrictions, again, with the Tobacco Control Act that was passed in 2009, it was really the first comprehensive federal regulatory scheme for regulating commercial tobacco products. And as I think you probably all know, it did restrict or prohibit the sale of all flavored cigarettes except for the most pernicious, the most pervasive, the one that has created the most health inequities, and that's menthol products. And that we've been dealing with that problem for now 13 and a half years, and it's been damaging, and many lives have been lost. And I think that has kind of dictated how some of the policies have developed and evolved over time. But it's been really exciting. The first policy that was enacted was in 2009, and I know Kevin was intimately involved in that. It was really exciting to have the first flavored restriction on the books in New York City. It didn't include menthol because it followed the model of the FDA at the time. Shortly after, in 2012, Providence, Rhode Island also passed a flavor restriction. Again, didn't include menthol. Providence was a little bit later, and so at that point, e-cigarettes had become more of a thing. So that was they were included in it as well. No menthol products were included until we got to Chicago. And Chicago, in a couple of years later, or in 2013, passed a restriction that included menthol, but it was a very limited. It only pertained to areas that were within 500 feet of schools or youth-oriented areas. All of these were litigated, and all of them were upheld. But it wasn't until we got to San Francisco that we had the first comprehensive policy on the books, and that was really exciting. And then from there, it's expanded. The proliferation has been remarkable. We now have between 300 and 400 local jurisdictions. California and Massachusetts have very comprehensive state restrictions. Other states have more partial, and then Washington, D.C. as well includes a comprehensive restriction on sale of flavored products. What is the industry doing? We know that the industry finds these very important because of how strong the reactions are. And it's been, as I said before, it's been a multi-pronged approach to it. First of all, what they were doing was sending these threatening letters to communities. This is one that many communities received, basically using very specious legal arguments saying, you can't do this, we're going to sue you, you're going to lose. This one was to Marion, Massachusetts, but many other jurisdictions received the same thing from Jones Day. And the attorney who signed these became the U.S. Solicitor General, but he's now back at Jones Day and has been been the lead litigator and doing the oral arguments for the industry in some of these lawsuits. But again, these were just really to chill local activity. And I'm sure they did in some cases, but the important thing was that they didn't in many others. And so we've seen so many more policies passed. Litigation, industry is always sued whenever they can. It's an effective policy for them to either try to strike down, even when they don't have a winning argument. It can often delay the implementation of policies. And so, as I said, New York City and Providence, so the First Circuit Court in Providence, the Second Circuit in New York City, courts upheld the flavor restrictions. In Chicago, when menthol was introduced, the district court level upheld it there. Los Angeles, California, and LA County, there's been litigation upheld by the Ninth Circuit. So in all these cases, I think the key takeaway is that the ordinances or the laws were upheld. So well-drafted law certainly falls within the authority of a state or local government. We're waiting on a decision in Edina, Minnesota. There was a comprehensive flavor policy that was passed there. It was upheld by the district court, and of course the industry sued, and we're currently waiting for the Eighth Circuit to issue its opinion. And then the last piece on the kind of the federal angle of this is that the industry has sought the Supreme Court to hear the LA County litigation. And we should have an answer on that next week. There's no good legal reason why they should. Usually they would look for something like a circuit court split or something where there shows some disagreement among courts. And in this case, again, because it's been universal, the law is very clear. We are hopeful and anticipate that the Supreme Court will see no reason to take this case on. I do want to talk just briefly about Massachusetts, though, and these are state level cases, so they don't dictate how a court in New York would see them, but it was on the enforcement aspect of it. It wasn't on the sales restriction itself. But as you know, the industry is always changing according to trying to evade the policies. And so they created a lot more concept flavors, products that don't intentionally say they're they don't say they're great, but they have a purple packaging, or they are called Maui Wowie or Jazz. And Jazz was the one that was really in question in Massachusetts. And so the question was, how can they enforce this? How can the enforcement agents decide which product is a flavored product? And so we've always focused our policies really on the user's experience with the policy. If it comes across as a flavored policy, it's a flavored product, it is a flavored product. The industry was arguing, no, you need to have somebody who's specially trained to identify which is flavored and which is not. And in this case, it was Yarmouth, Massachusetts said, no, we have people who can smell the product and make that determination. And the court said, that's fine. If it smells like a flavored product, it is a flavored product, which is exactly the ideal outcome that we wanted. We assumed the industry wanted to create a process where it required some specialized training, and then they would probably argue that it was, you were looking for certain ingredients and not actually what the user experience was, and that it was therefore preempted under federal law. At first, that tobacco product standard that I mentioned in the second slide. But this was a great outcome. It means that we can use the smell test, at least in Massachusetts, and I think that other courts will see it the same way, to identify what's a flavored product, which kind of it thwarts another one of the industry's approaches. Another way they've tried to stop these policies is outside of litigation. And they did this in California, both in the city of San Francisco and at the state level, where instead of suing, or in addition to suing in some cases, they put it on the ballot. And what that allows them to do is to spend a lot of money on defeating through a ballot initiative. But it also allows them to, in many, both these cases, to delay the implementation. At the state level, that was really important for the industry, they were able to. The policy was passed in August of 2020, but it wasn't put on the ballot until this past November. So for over 2 years, they were allowed to sell their products, and the estimates are that they made, just for the sales of menthol cigarettes, between $800 and $900 million in the state during that time. And not, that doesn't count the lives lost. That's just the industry profit that they made. And in both cases, they were resoundingly defeated at the ballot, which was great. But again, it shows, they're going to try different approaches. And for them, this was certainly, from a profit perspective, it was a winning approach for the industry. But it's, for public health, it's certainly, we end up being the ones who lose, even if we win at the end. And then I want to talk about exemptions, because that is also an approach that the industry has always used. It's whether it's been smoke-free laws and exempting certain types of businesses, menthol in the Tobacco Control Act, and again, and Kelly's going to talk a lot more about the specific equity aspects of menthol. But we know that exemptions are never included in a policy for any public health reason. What they end up doing inevitably is increasing health disparities. It's the people who are the most structurally disenfranchised who are going to pay the price, because that's who the industry is predatorily targeting. The other thing, and this is often an important point to make, especially for city and county attorneys, is that the addition of exemptions often leads to increased litigation. I think that a more comprehensive policy is less likely to be litigated, because you can't argue for differential treatment for different kinds of products or different kinds of businesses. And I think that's an important takeaway. Another reason why exemptions, not just because they're better policies, but they're less hassle for the jurisdiction. And recently, the exemption that we're seeing coming up in a lot of places, and it really, as Dr. Phil Gardner from the African American Tobacco Control Leadership Council says, it's really just an extension of the menthol arguments, where the industry is trying to get exemptions for hookah, using the same specious social justice arguments, the same, with all flavors, there's always this perception of reduced harm, reduced risk. And with hookah, that has always been a case because of the, smoking it through a water pipe. But we know that none of that is true, that the products are very dangerous. They're not being used the way that the industry is arguing. They're often popping up around college campuses and targeting the same people who the industry has continuously targeted. And again, I know this is something that Kevin has worked on for for over a decade, and when he was working for New York City in smoke-free laws. So this is just something that has come back in full force, and they've been pretty effective in making the argument in some cases, but there isn't any public health rationale for exempting hookah bars. And the next phase, and this happened almost immediately after, well, it was immediately, it was as soon as the California passed SB 793, their statewide flavor, when the referendum was passed, the industry introduced these new products, non-menthol cigarettes, some of the sensation ice, the cooling sensations, and we feel like our definitions include these. We really, again, we focus on the user experience. We're reevaluating some of the ways we define some of the products, but we're also hearing through other channels is that the products really still are flavored products, even though they say they're not menthol. The user experience is that they are mint or menthol flavored, so they should still be covered under the policies. But again, we want to make sure that we're thinking about these products when we're drafting definitions. So again, I would talk about definitions. I don't want to go through the whole thing, but we use this distinguishable by an ordinary consumer specifically in response to the Yarmouth case, because we want to make sure that it's very clear that it's whoever is purchasing and using the product, it's their experience that is most important in determining whether or not something is flavored. And then we also have this in our enforcement language, this rebuttable presumption. And this gets to the concept flavors and the products that aren't entirely clear that make it harder for enforcement. So looking at any claim or any statement that the retailer or the manufacturer makes that a product is a flavored product, or the packaging, we've seen purple packaging. And there's a lot of research showing that those do have a real impact on how people perceive the products. And we know that the industry is trying to do this as surreptitiously to sell flavored products in a way that isn't making it very clear that they are in hopes that there won't be an enforcement. So this rebuttable presumption just says, you know what, you prove to us that it's not flavored. We're going to assume that it is. And I think that has been an effective approach as well. So at the end of the day, I think what we would say is that these policies are extraordinarily important. We know that they're important. There's plenty of research showing they're important. The industry's response tells us how important they are. And that they are on solid legal grounds. A well-drafted policy is likely to survive litigation. More importantly, while it sounds like there have been a lot of lawsuits, when you look at the grand scheme of things, and there are 400 or so policies that have been passed, very, very, very few of them are litigated. So as long as it's a well-drafted policy focused on restricting the sale of the products, good definitions, we've learned a lot over the last 13 years on how to develop a good policy. And we're here to help if you have questions for us. But I will now turn it over to, and then I was just going to mention, we have lots of resources on this on our website. But again, I encourage you to, if you have questions, to contact any of us. We're always happy to help and talk you through any issues or to provide any analysis that would be useful to you. So I am going to stop sharing my screen and turn it over to Mike.
Thank you, Mark. That's very helpful. So, now that Mark's provided us with the background, I'm going to talk a bit about the specific proposal that Governor Hochul came out with as part of her budget process. So I am going to share my screen now. So that you should be seeing my screen. Yes, so Governor Hochul came out with a broad budget proposal. It included the tax proposal that Kevin spoke about, but it also included a flavor proposal, and that's what I'm going to talk about specifically. So we had a webinar in December, and I talked about the current state of the law in New York. So I'll just go through this pretty quickly. I do think it's important to mention how the law currently works before describing how it would be changed. So this may be a bit of a refresher to some of you, but it should be pretty quick. So this is the operative language of New York's flavored vape law. So the law applies only to e-cigarettes, and as you know, that's not great from a public health standpoint. When you're talking about flavors, the biggest problem from a public health and equity standpoint is menthol cigarettes, although flavored e-cigarettes are certainly a problem where youth is concerned. So it's not like the law is without merit, but it's definitely not comprehensive. The law applies only to sales that occur at retail. And that's led to some confusion about whether the law applies to the sale of flavored tobacco products from a wholesaler or distributor to a retailer. The law applies to products intended or reasonably expected to be used with the consumption of nicotine. An issue with this is that presumably it excludes non-nicotine vape products. And as you'll see, that is one of the issues addressed in Governor Hochul's proposal. But as with any law, you need to look at the definitions to know what it applies to. So what does flavored mean in New York's law? The definition uses some of the same language from the operative clause. That is, a flavored product is a product intended or reasonably expected to be used with a consumption of nicotine. But the law elaborates. The product has to have a distinguishable taste or aroma other than the taste or aroma of tobacco. So tobacco is still allowed as a flavor, and that aroma is imparted prior to or during consumption of the product. And the law lists a bunch of examples of flavors. It includes some you'd expect, like fruit, chocolate, vanilla, honey, candy, alcohol, and so on. It includes mint, wintergreen, and menthol, which are flavors excluded from some local ordinances, including New York City's. But since the law applies only to vapor products, it doesn't cover menthol cigarettes or flavored cigars. It includes concept flavors, which Mark talked about, like Arctic or solar, and that's helpful to address the lengths to which the tobacco industry will go to avoid public health laws like this one. And the law has an exception for products authorized for sale by the FDA. And at this point, no flavored vapes have been authorized by the FDA, so no products actually fall into this exemption. But that could change at some point. The penalty in the law is a $100 civil penalty for each package of flavored e-cigarettes sold in violation of the chapter. There's a reference to another chapter of law that describes a complaint process. Any person can submit a complaint that the flavored vape law has been violated, and that can lead to adverse action relative to the retailer's licenses. So that's kind of the background. How would Governor Hochul's proposal change these laws? I looked at the governor's executive budget for the language. Unfortunately, it's 1,100 pages long. Fortunately, I didn't need to read all of it, but there is a caveat before describing the language that's in here related to flavored tobacco products. It will almost certainly go through changes as it goes through a legislative process, but it is helpful to know the starting point. So let's look at the language itself. Now, just a word about legislative language. This is directly taken, these are screen grabs directly taken from the budget proposal. And in New York, when you're looking at legislative language, if the language is in brackets, that means it's being deleted from existing law. If it's underlined, that means it's new language that's being added into law. And if it's neither underlined nor bracketed, that means it's existing statute. So here you see they add in the words or tobacco, which is only 2 words being added to the statute, but this is a huge change, and this is the bulk of the change. It changes the law from a flavored vape law to an AFAP-IM law. That abbreviation is some tobacco control jargon that I just heard for the first time the other day, but I like it, so I wanted to use it. It stands for all flavors, all products, including menthol. The new language also deletes the requirement that nicotine be present and clarifies that the flavor need only be distinguishable by an ordinary consumer. And Mark talked about this. That means you don't need any specialized knowledge to tell it's a flavored product. A couple other things worth mentioning. A cooling or numbing sensation is added as an example of flavor because tobacco companies are starting to use terms like that to avoid flavor restrictions when consumers know it's a menthol product. It also excludes authorized cessation products, which is a good public health practice, unlike the exemption for products authorized for sale. You want to encourage people to use cessation products that we know work. The language would also get rid of the requirement that the only prohibited sales of flavored products are those happening at retail. Earlier in the bill, there's a new definition of tobacco or vapor seller that includes wholesalers. So we know the wholesale sale would be included now under this legislative change. And there's new language making it clear that the law does not prohibit the purchase, use, or possession of flavored tobacco products. This is intended to make it clear that the law will only target the retail sale of flavored tobacco products and addresses the equity concerns related to law enforcement encounters. And I believe Kelly is going to talk about that next. So there are some additional provisions I just wanted to highlight. There's new penalties for denying state or local health officials access to a retail store and storage areas. Vapor products are added to the prohibition on selling tobacco products with a suspended license. There's the removal of the exemption for products authorized for sale by the FDA. I think since you'd be expanding the law, the scope of the law to include flavored tobacco products, I think that's important to remove that exemption. And there's removal of the language that says the product has to be reasonably expected to be used with or for the consumption of nicotine. And this will help make it clear that all flavored vape products are prohibited from being sold in New York State. And that's a change made kind of throughout the bill. That's all I wanted to talk about. So here's my contact information if you want it. I'll stop sharing my screen and I will turn it over to Kelly.
Okay, thanks, Mike. And thanks for not walking us through every page of the 1,000-page bill. Okay, let's see here. So I'm going to talk about the fun part. Actually, it's the really demoralizing part, the exploitation of myth by the tobacco industry. We're going to start with some discussion of flavor restrictions. It's going to be limited to that. Kevin already covered some of the opposition arguments. We'll put that in quotes when it comes to the tax increase. So my section is focused on flavor. All right. So let's start with maybe a couple points to ground ourselves. This is getting us into reality. So comprehensive bans on the sale of flavored tobacco products improve and advance health equity and save lives, particularly in BIPOC communities. We know that that's true. Flavor restrictions are bad business and for profit margins for the tobacco industry. So these bans will cause the tobacco industry to lose a lot of money. So that puts them into overdrive, trying to distract and scare communities with misinformation. And everything old is new again. They've been recycling and repackaging these same lies for years. The common industry tactics have and continue to include lobbying against public health grounded legislation. They solicit comments from front groups funded by the industry, and they misrepresent scientific findings. So I'm going to go over some of the most common myths. We don't have a whole lot of time, so I'm going to try to go through them quickly. We're going to talk about the myths that they weaponize to oppose this flavored product sales ban. We've seen these most recently in Westchester. We've, of course, seen them over the years in New York City, other parts of the country, and now we're seeing them statewide in New York. So myth number one, flavor bans fuel the illicit market. And this is something Kevin already spoke about in the context of the proposed tax increase, but it's also being invoked when it comes to the comprehensive flavor ban. But the truth is that jurisdictions that have banned the sale of flavored products, including menthol, have not experienced an increase in illegal cigarette sales after the ban. So Canada was one of the first countries in the world to ban menthol cigarettes. All provinces implemented a ban between 2015 and 2018. And we just actually have access to a new study out of Canada last month, looking at the impact of menthol cigarette bans on use and purchasing of illicit cigarettes in 7 Canadian provinces. The conclusion was that they found no increase in illicit purchasing of menthol or non-menthol cigarettes after the ban. Obviously, some of this needs to be taken within context because each country and locality is unique, but this certainly supports the idea that bans on menthol and comprehensive flavor bans do not lead to a surge in illegal sales. Okay, and here is a photograph snapped by Nicole from the Cortland County Health Department. Thank you, Nicole, for permission to use this. This is a poster found, I don't know if you can see this, it's a poster found on a gas station door, which leads one with the QR code to a website that asks you to contact your legislator, the governor, state senator, lieutenant governor, or governor. And so this actually claims that there is no impact on public health when we do this flavor ban. And this was sponsored, I should note, by the New York Association of Convenience Stores. The Campaign for Tobacco-Free Kids has actually published a list of tobacco industry funded opponents. And we can see on that list that NYACS makes the cut and that Altria, Reynolds, and Swisher International hold director seats on the advisory board. And that Altria and Reynolds were recognized as 2017 Spirit of NYACS members. So we also know that, and I think it's worth, I can include a link later to that document, that list. The reality is that comprehensive flavor bans lead to a decrease in youth tobacco use and initiation. And nationwide, we've seen research studies that have found flavor bans are associated with reduced availability, marketing, and sales of restricted products. In San Francisco, there was a study of their comprehensive restriction on flavored tobacco sales, including menthol, and it looked at the impact compared to 2 California cities without the sales restriction. And it found that virtually eliminated flavored tobacco sales and decreased total tobacco sales in mainstream retailers. In Canada, that same study I was referencing earlier found that the rates of menthol smoking decreased substantially after the ban went into effect. And in New York City, there's some interesting data that talks about a simulation of the impact of a menthol ban on cardiovascular disease. It found that over a 20-year period, a ban would result in a 5% reduction in heart attacks, 3.8% reduction in strokes, and over $1.6 billion in cost savings. And it's also worth noting that this same study found the most of these gains would be among women, particularly Black women. Okay, so another common myth that flavor bans target communities of color and single out menthol cigarettes. As Mark talked about, menthol cigarettes were left out of Congress's ban on flavored cigarettes in 2009. So this proposed comprehensive flavor ban would actually close the gap, this longstanding gap, albeit on a state level. So it does in fact implicate racial justice and equity. It's just not in the way the tobacco industry would have us believe. Tobacco use is the #1 preventable cause of death and disease among African Americans. Almost 9 out of 10 African Americans who smoke use menthol cigarettes. And this is no coincidence. We know for decades, the tobacco industry targeted Black communities with menthol for tremendous profit, researching and appropriating Black culture along the way. And even more insidious, we know that they have taken advantage of racial economic inequity to gain cultural influence. They fund and sponsor Black publications, cultural events, educational institutions, and civic leaders. The good news is that a lot of folks are speaking out about these myths and challenging them. We saw that challenging this co-opted narrative of racial justice. There was an op-ed by Dr. Philip Gardner this month in the Washington Post, and he talks about the way that menthol is more addictive and that these products fuel a cycle of addiction that's harmful to the pocketbooks in Black communities and also fuels death, health problems, and medical costs, and encourages the tobacco companies to take responsibility. We also can see Shaniqua Charles, who's the executive director of Miss Abby's Kids, and she's part of the Menthol Kills New York City campaign. She had a great interview on New York One, and I encourage you to watch it. The other thing that was released very recently within the last couple of days is some data out of the New York State Department of Health's Chronic Disease Public Opinion Survey. 70% think that of folks surveyed think that the marketing of tobacco products directed specifically towards communities of color is either a very or somewhat serious public health problem. Another common myth that flavor bans lead to over-policing. And we can see that we've seen these kinds of headlines and testimony in Westchester and elsewhere. We all know that excessive force and systemic racism exist independently of public health measures, and they must be addressed. But this linking of a flavor ban to over-policing and criminalization of communities of color is just a tobacco industry talking point that exploits the real historical and present day trauma of police brutality and mass incarceration. And so these tobacco companies are using these tactics to distract us. Again, we saw this opposition, along these lines voiced at the Westchester hearing, but they don't offer any statistics or data to support this claim. And at first glance, again, we might think that there's that the folks being quoted or testifying are doing it in earnest, but very frequently they are, upon close examination, being funded to spread this messaging for the tobacco industry. So in reality, health departments, as Mike talked about, are the ones who are going to be implementing these flavor restrictions, not the police. And the proposal that the governor has introduced, has released, mirrors best practices in public health. It would prohibit the sale, again, of menthol cigarettes, tobacco products, including menthol cigarettes, by wholesalers, distributors, and retailers, but not individual consumers. This flavor proposal does not criminalize or in any way punish individual use or possession. There's also, I think, a myth that is out there that commercial tobacco use is just a personal choice. It's everyone's decision. But the truth is no one becomes a smoker if they don't start smoking before 25. And they target, the tobacco industry targets young people and designs products to maximize addictiveness. So this is especially true with menthols, which explains why even though Black people start smoking later, smoke less, and try to quit more than any other racial group, they're significantly less likely to quit. So myth number 6, educate and enforce, don't ban. So as if and this was something that was included actually in the letter from Westchester County Executive George Latimer that accompanied the veto. We know it takes all kinds of actions to reduce tobacco use and save lives, but this is a false choice. All of these things need to happen at once. Cessation programs are critical to addressing the real and urgent issue of addiction to nicotine. And the other thing that's worth noting is public support in New York for expanded flavor restrictions. I'm running out of time, so I'm just going to wrap up quickly here. Another myth that's put forward is that we have to ban flavored cannabis at the same time that there are restrictions on flavored tobacco. I think the picture says it all. These are different products. The most obvious difference between the two of them is the medicinal properties of marijuana, of cannabis. And again, we don't need to do both at the same time. There can be exploration of regulation of cannabis, but for our purposes here, cannabis regulation does not have to happen alongside flavored tobacco policies. And the last one, on a good note, mythical reality, people will say, well, then why don't we ban all cigarettes? And we say, great idea. It's called Endgame. And the reality is there is support for a public support for a total ban. And here's a little bit of data that can support that as well in a recent study released by the CDC. Okay, so I think I'm out of time. I'm going to turn it back over to Zohal, see if we have time for maybe a quick question.
There we go. Thank you so much to all of our speakers. I know we're short on time. I wanted to see if there was one question that was sent via email beforehand. I wanted to see if we could get to it. The question was, flavored vapes are not being enforced very well, and the Adolescent Tobacco Use Prevention Act program is overwhelmed. How can this be effectively enforced, and will the proposed budget have money to put towards enforcement? So I think Mike maybe wanted to speak on that.
Sure. Unfortunately, the proposed budget is flat and there's no extra money for ATUPA enforcement. But, you know, there are a couple caveats to that. The budget could change through the legislative process. And hopefully some of the changes to the language itself will help with enforcement, like getting rid of the requirement that the only prohibited sales are those that happen at retail. So, but the short answer is there's no additional funds.
Great. Well, thank you so much, everyone. I know we're out of time. Thank you for joining. You'll receive a brief survey after the webinar is over. Please take a moment to fill it out. We really appreciate your feedback. And there were a few questions that were also answered in the Q&A. We will also be sending out a recording of this webinar to share with you all, everyone who's registered afterwards. And if you have any, if you would like any other information, please check out our website, publichealthlawcenter.com. Thank you for joining today.